Good morning, everyone, and very warm welcome to this webinar. And we are going to start with an intro video. Just stand by. Over to our anchor to start the session, please.
The very first requirement in the hospital is that it should do the sick no harm. Those are the words from Florence Nightingale. The Association of Nurse Executives India is committed to zero harm. Association of Nurse Executives India, known as ANEI, is proud to be presenting its third annual Patient Safety Conference. Good morning, ladies and gentlemen. I, Lisa Pipandriwala, fourth year student of Asian Institute of Nursing Education, your anchor for Track 1, warmly welcome each one of you to this event. Without further ado, we will begin the program with an invocation and a dance by the ANEI Northeast Chapter.
জয় ঋষি কে খবর সৃষ্টি স্থিতি প্রলয় ব্রহ্মারূপে অবতরী সৃজন বেদনাদায় ত্রাহিমা ত্রাহিমা ত্রাহিমা
Thank you, AINE team, for that beautiful, prayerful performance. Moving on with the program, I now invite Dr. Ranju Ranidas, the President of Northeast Chapter, ANEI, to kindly give a brief introduction to Towards No Harm, Elevate the Voice of the Patients.
Thank you, Lisa. An incident is just the tip of the iceberg, a sign of a much larger problem below the surface. A warm good morning to one and all present in this digital platform. First of all, I would like to convey my heartfelt gratitude to Madam Thangam Gomez, first president and founder member of ANEI, Madam Ajita Nair, national president, and the national officials of ANEI for giving the opportunity to the Northeast chapter to host this prestigious event, the third annual Patient Safety Conference. Patient safety is a global issue. Despite of significant advancement in healthcare, millions of patients are harmed by unsafe healthcare. According to the World Health Organization's Patient Safety Action Plan 2021 to 2030, in high-income countries, it is estimated that 1 in 10 people are harmed while receiving care in the hospitals, and up to 15% of the hospital expenditure is due to safety failure in care. In low and middle income countries, it estimates 1 in 4 patients that are harmed, with 154 million adverse events occurring annually due to unsafe hospital care, contributing to around 2.6 million deaths. Ladies and gentlemen, patient safety is fundamental to the delivery of quality healthcare to the patient and significant others. And today, our conference is focused on the theme towards zero harm, elevate the voice of patients. Since 2021, every year, ANI has been organizing patient safety conferences. The important landmark of this year's patient safety conference is pre-conference workshop on international patient safety goals, which are designed to reach to all the nursing students of India to create awareness and to promote a culture of patient safety so that our students can play a vital role to reduce patient harm. A safe patient is a happy patient. Together, let's build a world where every patient feels secure in their care. Mistakes may be inevitable, but harm is preventable. Prioritize patient safety every day. Focusing on the patient safety is our responsibility towards the goal of zero harm. Engineering of safe care in all settings, ongoing commitment by the healthcare providers and patient advocates together are essential for minimizing harm. The best practices like a culture of safety, continuous education, teamwork, effective communication, effective leadership, and careful analysis of errors to identify root causes can be standardized across the healthcare to build a more resilient and durable system of safety. The patient is the core component of healthcare system. Patients and families' involvement in self-care and sharing their experience of care received, their observation and opinion will help to resolve not only safety issues, but also better care. The impact of meaningful engagement of patients and their family members in patient care is remarkable, with the studies showing a potential reduction in the burden of harm by up to 15%, saving countless lives and billions of dollars each year. For this, World Health Organization has embedded patient and family involvement as a fundamental principle in World Health Assembly resolution on global action on patient safety and the Global Patient Safety Action Plan 2021 to 2030. So, healthcare teams and organizations should provide a safe environment for patients to raise their voice, express concerns, questions, and ideas openly and without judgment. Many a time, the patient and their families are not aware that they also can involve and contribute in their care. Rather, they expect all the care to be provided by the healthcare provider as they are spending money. So we have to educate the patient and the family member to enhance their awareness and knowledge of safe and effective care. Patients are not only the recipient of healthcare, but also partners in healthcare. The healthcare team needs to understand the important role of patients and significant others and partner with them to integrate effective patient engagement into clinical practice and healthcare systems. They should be included in the decision-making process also. Focusing on the theme, today we have a panel discussion on engaging patients and families for safer care, where a team of patients, clinicians, quality control personnel, CEO, CNO, and young nurses will contribute their opinions about how effectively the families and the patient can involve in safer care. Next, the eminent speaker will deliver a talk on patient safety. ANI always provides a platform for continuous improvement in nursing practice. Today, in this forum, the best 3 projects regarding evidence-based practices on medication safety and quality improvement projects around involving patients and families for safer care will be presented. Today's young nurses are the future safety leader. The patient safety conference will be incomplete without their challenge for patient safety is not to place blame or to punish someone, but to prevent the errors from occurring. That requires transparency in healthcare systems and the willingness of health professionals to confront failing. To err, after all, is human. We all may make mistakes, but one needs to learn from them and find ways to make sure that they never cause harm again. With this, I'm sure that our energetic and enthusiastic participants will be benefited and will extend their hands in making healthcare a safer place for our patients. Thank you. Long live ANEI.
Thank you, madam, for the detailed information you have shared with us. It is my honor to invite our ANEI National President, respected Captain Ajitha Nair, who is an entrepreneur, Managing Director, Hillbees Healthcare Management Solutions Private Limited, a very active and vocal nursing leader of the country, taking the ANEI movement in a fast-forward momentum. Inviting Ma'am Ajitha for the welcome address.
A very warm and pleasant morning to all of you gathered here. It is a matter of great pleasure and privilege to offer the welcome address to the dignitaries and delegates today on the momentous occasion of our third National Patient Safety Conference. Association of Nurse Executives India, which we call ANEI or ANI, since its humble beginning in 2017, has been instrumental in empowering the foot soldiers of healthcare, the nurses at the bedside, with not only knowledge, skill to deliver patient care while ensuring patient safety, but also supported by strong nursing leadership at their place of work. Since 2021, we have very successfully conducted national conferences on vital aspects of transformational leadership. In addition, we have made the Patient Safety Conference of today an annual September feature. Needless to say that we as an organization are most serious and ever passionate about working towards making zero preventable harm while delivering patient care in all settings. And as this conference unfolds today with the theme, Towards Zero Harm, Elevate the Voice of Patients, you will witness globally significant and impactful professionals who are absolutely passionate about patient safety speaking to us. Our chief guest today is Dr. Neelam Dhingra, Unit Head Patient Safety Flagship World Health Organization, Geneva. And as she desires to address us in person, she gave us the time in her busy schedule today at 3:30 p.m. As we await her talk, I extend a very, very warm welcome to her. Ladies and gentlemen, we have a very special guest today amongst us. Is none other than Dr. Michael Ramsey from Texas, the United States. He is the Chief Executive Officer of Patient Safety Movement Foundation, United States. He is an anesthesiologist by profession, and all of you are familiar with his name as the inventor of Ramsey's sedation scale, used widely in clinical practice by all of us. We conduct our flagship program, ANEI Patient Safety Fellowship, in association with Patient Safety Movement Foundation. And I am excited to announce that we had our graduation of the first cohort of 7 fellows yesterday in the presence of Dr. Michael Ramsey. I extend a very, very warm welcome to you, sir, to this conference, and would like to place on record our sincere appreciation, and we are ever grateful to you for your support. I would also extend a very warm welcome to all our international speakers for today. Dr. Donna Process, Associate Principal, Reliability and Management Systems, Busient Inc., North Carolina, USA, who was instrumental in starting our fellowship in patient safety program. And Ms. Olivia Lonsbury, Quality and Safety Program Coordinator at Johns Hopkins Children's Center in US. We are starting a very significant association with an organization, Patient for Patient Safety, today, and its chairman, Dr. Som Mittal, is with us today speaking to us. We will be signing a memorandum of understanding with Patient for Patient Safety Association today, so as to contribute more towards elevating the voice of patients and empowering them while seeking healthcare. A very warm and cordial welcome to you, sir, as well as your team, including Ms. Nadira and others. I would also welcome all our speakers for the day. Dr. Lalu Joseph, Secretary General of CAHO, Dr. Ashish Malakar, Group CEO, GNRC Hospital, Guwahati, Assam, Dr. Reshu Gupta Khanikar, Senior Consultant and Head of Department of Critical Care Medicine at Health City Hospital, Guwahati, Dr. Sanjeev Kakati, Director Management Services, Third Eye Education Private Limited, Ms. Urmila Barua, the Managing Director, Human Network, etc. A very, very warm welcome to all of you. Today we have our Patient Safety Projects competition, and the judges, Dr. Sunil Munpur, Professor in Pediatrics and Advisor Quality, Kasturba Medical College, Manipal, our international member of ANEI, Dr. Vijay George, who is Magnet Program Director at Texas Health Systems in US, and Ms. Prajakta Hindlekar, Nursing Director and Chief Experience Officer at Breach Candy Hospital, Mumbai. I extend a very, very warm welcome to all of you. We have our very distinguished ANEI members as speakers and chairs of various sessions today. Ms. Tangam Gomez, Ms. Kavaljit Oberoi, Ms. Minnie Burgess, Ms. Karishma Count, and Ms. Deepa Chuk. And I extend very warm welcome to all of you. We had an overwhelming registration response, over 3,000 for this conference. Also, we will be live on Facebook because of this. And I extend a very, very warm welcome to all the delegates who are present over here. I would also like to acknowledge the role played by the organizing committee headed by Ms. Tangam Gomez and the Northeast chapter and other ANEI officials. I extend warm welcome to all of you, my ANEI family members. Wish all of you a very fruitful and thought-provoking sessions and valid and practical take-home lessons for the day. Let there be a day where no one is harmed in the process of healthcare, and we shall work tirelessly towards that goal by all means possible. Thank you, everybody.
Ajita, please call Dr. Michael.
May I request Dr. Michael Ramsey to deliver his address, please? Over to Dr. Ramsey.
Thank you for the kind introduction, and thank you for inviting me for a second year here to your really powerful conference. And as I think you said, I was present yesterday at the graduating class and listening to their projects, and none of them undertook a minor project. They took the toughest projects, things like pressure ulcers, handover care, wound infections. And boy, the studies they did, the data they produced, the improvements they produced was really outstanding. So I think you have a powerful force of graduates and teachers. And I think these graduates will go on to be part of what I term the patient safety army. And this is everybody involved with the care of the patients. We bring everyone together, from the hospital administrators, the nursing staff, the physicians, the clinicians, but also the politicians, also the medtech companies, and most important, the patients. And to bring them, then we start to have a patient safety army that can make a difference. And so that's what we all have to be part of. We have to spread it around the globe. And that's what Dr. Neelam Dhingra is doing. And I really have to spend a minute or two just recognizing the work that she has almost done single-handedly at the WHO, the World Health Organization. It's been really phenomenal how she's brought patient safety to the top and made it global. We now have World Patient Safety Day, which was September 17th year, and around the globe, many big buildings were lit up in orange to recognize Patient Safety Day. This year is the engagement of the patient and listening to the patient's voice, putting the patient number one, as we always should have done in the past. But this is Dr. Dhingra. She has really almost single-handedly involved everybody in the world who's got an interest in patient safety to get their input to put together the plan, the World Safety Plan, action plan for the next 10 years. And so I've got to applaud her very much for the work that she's done. Now, I work as the CEO of the Patient Safety Movement Foundation, and we've been in action now for just over 10 years. And we came up with 4 things that we really wanted to achieve. One was transparency of data. And what do I mean by that? I mean, we don't know the extent of patient harm. At least we did not know. Now, in some countries, including the United States, there's technology using AI and machine learning where we can now mine into electronic records and using trigger technology can start to identify patients who underwent harm and adverse events during their stay in hospital, and we can have a clinical team look at the data to see, was this, in their opinion, preventable harm? And the data that's coming out of this, particularly on our government-funded patients, because we have better access to that data, because the government pays for it through the Medicare and Medicaid and Veteran Services Fund. We know that 25% of these patients in the United States experience harm during their hospital stay. And when that harm is looked at, it's around a quarter of that harm is preventable or deemed to be preventable. And so we want this data now, because the technology is there, we want it spread around the whole of the country and then around the globe, so that we really get full, transparent reporting. We don't want hospitals to underreport, as many do. We want to know the real data, because once we know the real data, we have a goal we can look towards, and we know when we're making a difference. And then we want to know everybody's individual data, because we're all a little bit competitive. And when my data is not as good as your data, it spurs me to make a difference. And so number one, transparency of data. Number two, we want evidence-based practices in place. In other words, the standard of care for basic things shouldn't differ across the globe, across the country, across states, across hospitals. In other words, if you're going to operate on the left kidney because there's a left kidney cancer, there is no way you should be operating on the right kidney. And yet that still happens, and it happens too often. That patient will then end up with a bilateral nephrectomy and have to go on dialysis if they survive this. And so some things are totally never events. And so we want standard of practices, evidence-based practices that are living documents in place for the major causes of harm in every hospital, not just in the United States, but across the globe. Then we want a national patient safety team, rather like the transportation industry or airline industry, where they can look at some of the really serious events of harm, patient harm, and look to see what they come up with in terms of preventive care. We don't want this to be a judgment or jury. We want this to be an investigation team to find the causes of the harm. And I think with that, and then payment for aligned agendas. We want payment for quality of care, not quantity of care. We want the care that's provided to be good care. And as long as the evidence-based best practices have been used, if there is a complication, and often there is, because we're dealing with human beings and as patients, and human beings are fragile, incredibly fragile. The coronary artery of that first-class football player is only 5 millimeters in diameter. A little plaque could come off and he has a heart attack. As patients get sicker, so they become even more fragile. And so it's not the same as the airline industry or the nuclear power industry. Healthcare is very special, and we need to treat it as special. And we need to help the healthcare team, the nurses, the doctors, because they are under stress. They do not want patients to be harmed at all. We've got to be very proud of our healthcare team and support them and provide them the tools so that they can help to protect the patient. And of course themselves, because certainly in some areas, and that includes the United States, healthcare workers now are at risk as well, not just from burnout and depression and things like that, but also violence from some patients that come into the hospital. So it's a difficult problem, but I'm feeling optimistic now that with organizations like the ANEI, like the WHO, like the multiple patient safety organizations that are developing, that we now have momentum. And one of the big things in the United States is that the president of the United States always has an advisory council, and he has different aspects of policies. He has one on science and technology, and he charged them 2 years ago with looking at patient safety. And their report came in last month, and it's basically what our websites got on it, which I've just went through with you. Those 4 major things are on the recommendations to the president to enact. Now, that brings in politics. And of course, the politics in many countries, including the United States, is pretty tough. And so once you start to bring in something that may cost money, will bring politics in. But the bottom line of patient safety is eventually it will save lives and save money because it will reduce complications. And so there'll be an initial charge of some funds to into place the collection of data, the installation of these evidence-based practices, but ultimately it will all pay for itself, and there'll be a big return on investment which saves lives and saves money. So we're optimistic that the president will hopefully sign off on all of this, but maybe being politics, he'll only sign off on some. But one thing that the president does have in his power is that as the government is the major payer of medical care in the United States through Medicare, Medicaid, veteran services, Indian tribal services, he could institute it in those patients that the government's already funding. And for most hospitals that take on these patients as well, they're not going to have 2 systems, so they'll put in these evidence-based practices as well and all the other measures into their own hospitals. So I'm very optimistic that with the patients involved now, and patients this year being number 1, that the pressure on the politicians will be great to make this move, make this enactment, accept the advice they're being given, and let's make healthcare so much safer for everyone involved in it. And so I want to just applaud you all for what you're doing with ANEI, and the rest of the audience who are listening in because you're interested in patient safety, you're advocates of patient safety, That's what we have to have the ball rolling for patient safety, get the patient safety army put together to get these changes made, and let's make healthcare safer. So with that, thank you so much indeed for the opportunity to come and talk to you. And I look forward to the rest of your meeting. So thank you so much.
Thank you very much, Dr. Michael Ramsey. We are really indebted to you for all the support what you give, and I promise you that ANEI stands for patient safety, and we will do all that what is possible to minimize or the preventable patient harm and make it much more safer than what it is today. Thank you very much for your enlightening talk, and you are a living testimony of patient care, whatever we do, and we draw a lot of energy and courage from you. Thank you very much.
Thank
now,
you.
may I request Krishna Chaudhary to propose the vote of thanks.
Thank you, ma'am. Namaskar. The essence of all beautiful art is gratitude. A very good morning to one and all attending the most awaited third ANEI Annual Patient Safety Virtual Conference 2023 with the theme Towards Zero Harm, Elevate the Voice of Patients. I, Mrs. Krishna Chaudhary, Secretary of ANEI Northeast Chapter, on behalf of the organizing team, have been very humbled and honored to be the one making the closing remarks and delivering the vote of thanks in such a distinguished and intellectually stimulating gathering. Let me first of all start by giving glory to the Almighty God, hoping to make this conference a resounding success. First and foremost, I'd like to express my deepest gratitude to our esteemed guest of honor, Dr. Michael Ramsey, Sir, CEO, Patient Safety Movement Foundation, USA, for gracing this occasion with his esteemed presence. Thank you, sir. From the depth of our hearts, we are grateful to Madam Captain Ajitha Nair, National President, ANEI, for her continuous support and guidance. Thank you, ma'am. My heartfelt thanks to the ever-dynamic leader and the guiding force behind organizing this conference, none other than Ms. Thankam Gomez, ma'am, founder, EC member, and first president, ANEI. Thank you, ma'am. We are ever grateful to the national executives of ANEI, Dr. Unmona Borgohai Saikia, ma'am, National Vice President, ANEI, Mrs. Vinci Tribhuvan, ma'am, National Secretary, ANEI, Dr. Aji, ma'am, National Treasurer, for your constant support, guidance, and assistance. I would also like to take the opportunity to thank Dr. Ranjurani Das, ma'am, President, ANEI Northeast Chapter, Mrs. Bova Yania, ma'am, Vice President, ANEI Northeast Chapter, and the entire organizing team members of Northeast Chapter for your untiring efforts in making this conference a huge success. I owe special gratitude to the esteemed speakers of the conference throughout the day, whose thought-provoking and insightful deliberation will help us to achieve our goal towards zero harm in context to patient safety. I would like to express my sincere gratitude to all the distinguished participants across India who has participated in this conference. Once again, I thank you all for all your kind attention. Thank you. Long live ANEI.
Thank you, Captain Ajitha, and thank you, Dr. Michael Ramsey, for the powerful initiation of the day. And thank you, Ms. Krishna. We're also looking forward to hear from Dr. Neelam Dhingra from WHO at 3:30. Please don't miss it, guys. So we have come to the end of this inaugural session, the track 1, and I hand over the next track to Ms. Aditi Sharma. Thank you.